Hello, good evening. Welcome to today's Facebook Live. This is Facebook Live number 12. Today we are talking about tips for ordering sleep studies as a non-sleep physician. If you're joining me live, thank you. If you're watching the replay, let me know by typing replay in the comments, and I'd love to know where you're joining from, what your specialty is, what questions you have about clinical sleep medicine. If you don't know me, I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry, and I'm board certified in sleep medicine as well. I have a YouTube channel teaching clinicians all about clinical sleep medicine, and I have an online course called the Clinical Sleep Kit. Doors are opening next week, so I can share more information about that if you are interested. So today we're talking about some tips for ordering a sleep study if you are a non-sleep physician. I get this question from time to time from colleagues of mine, psychiatrists and primary care doctors, about the best way to order a sleep study if you suspect your patient has obstructive sleep apnea or some other sleep disorder. Here's what I usually recommend. I suggest that you start by referring for a consult with the sleep physician in the sleep clinic rather than ordering the study yourself. The reason for this is that when you refer the patient for a consult, they can get that full sleep consultation, and then the sleep doctor can determine the type of sleep study that might be best suited for that patient's needs, whether they need a polysomnogram or a home sleep test. Sometimes that's driven by insurance as well. Sometimes an MSLT or multiple sleep latency test might be indicated if the patient has any symptoms of a hypersomnia like narcolepsy. But even me as a sleep physician, I'm not working in a sleep clinic. My private practice is a psychiatry practice. When I send patients for sleep studies, I actually refer them for a sleep consult with the sleep physician because I want them to get that end-to-end care, to meet with the sleep doctor, to get their study, to have their study interpreted by the sleep doctor, and then set up with any treatment that they might need, whether that's CPAP or another treatment plan. Sometimes I will manage the patient myself, but like I said, my practice is set up for psychiatry, and I'm not set up for like DME, like durable medical equipment, to do PAP therapy or things like this. So that's the first thing I recommend, is to send them for the consult rather than for the sleep study. Now you might be thinking, well, it takes ages to get patients in for a sleep consult. I know here in the Bay Area, it can take months to get patients into UCSF or Stanford or some of these clinics. So there are some online clinics now that do offer excellent care that can get your patient in pretty quickly, and they'll offer sleep testing. So the two companies that I recommend, both of these are physician founded, which I think is great. One of them is called Empower Sleep. It's EMPOWER Sleep, founded by Sahil Chopra. He's a sleep medicine physician. He actually did his sleep training at the same program I did at Beth Israel Deaconess in Boston. And they do some really interesting work with multi-night testing. They use the sleep image ring for home sleep testing. It's not the same as like an Oura ring like what I have. It's a professional grade ring that is based on cardiopulmonary coupling and different algorithms, and it's really cool. And they can do up to 100 nights of testing with that. So I've been actually sending my patients to Empower Sleep. They're licensed in multiple states. The other clinic that I recommend is called sleep.com. It's SLIIP.com, so SLIIP.com, also physician founded, and they offer sleep consultations in multiple states as well, and they do home sleep testing, and they offer excellent care. So those are the two clinics that I recommend. There's other ones out there. If you know of other ones, please put those in the comments too, so that we can all share resources and knowledge with one another. But so these are some options for you if you're not able to get your patient in for a timely sleep consult in your local area. A couple of other quick things I wanted to mention is that if your patient has had a home sleep test, keep in mind that this is often a screening tool. It can detect sleep apnea in patients with a high pretest probability of sleep apnea, if they're more likely to have moderate or severe sleep apnea, but it can miss sleep apnea in milder cases, or in patients who don't have a high pretest probability, patients who are petite or thin, or in women as well. And home sleep tests don't actually measure sleep. They're measuring breathing, but there's no EEG, so we don't actually get a great sense of when the patient was asleep and when they were awake. This is true for most home sleep tests. Some of these algorithms are changing. So if your home sleep test is negative for your patient, that doesn't mean they don't have sleep apnea. Sometimes a polysomnogram or an in-lab sleep study would be indicated. These online sleep clinics that I mentioned, because they do home sleep testing, if the patient does need a polysomnogram or they need an MSLT, they will coordinate with a local sleep center that offers in-lab testing to get those things done. So home sleep test is negative, but you still suspect sleep disordered breathing or sleep apnea in your patient, you can then get a in-lab study. Even with an in-lab study, sometimes one study is not enough. Sleep apnea can fluctuate from night to night. So even if your patient has a negative sleep study on a polysomnogram and it didn't show that they have sleep apnea, that doesn't necessarily mean they don't have it. It just means that it wasn't picked up on that night. So again, if the patient is having symptoms, then you can go ahead and do a repeat study when indicated. So sometimes multi-night studies are indicated, and that's why multi-night testing can be really helpful. The last thing I'll just mention here quickly is that once you've gotten a consultation with the sleep doctor, you should coordinate with that sleep clinic. And I know it can be hard to coordinate with outside clinics sometimes, but many sleep doctors, like myself, are open to coordinating with other healthcare providers on the patient's team to make sure they're getting great wraparound care. And I do recommend developing a relationship with some sleep doctors in your area, whether it's with a freestanding sleep clinic or their sleep doctors at a larger hospital or a larger center, making that personal connection, no matter what specialty you're in, it always helps, and it always helps patients feel supported as well to get the best quality care and to not feel like their care is siloed, which is often the case in our healthcare system. So hopefully that was helpful. Just a few tips on ordering sleep studies. I'm opening doors to my clinical sleep kit program next week. I'll be doing a series of free masterclasses on different sleep supplements to help your patients optimize their sleep. Sleep supplements are not a solution for sleep disorders, but they can be a really useful tool in your toolbox, especially in certain cases where they have a lot of evidence and they can be transformative for your patient's sleep. So I'm going to be talking about 5 different supplements that I like to use with patients, and we'll talk about indications, dosing, quality considerations, and so on. There's 3 different dates, February 13th, 14th, and 21st, where I'll be doing these masterclasses. You can choose the date that works for you. The link will be in the comments there, so you can look and see what's available and choose the link or the time that works best for you. It is live, so I'd love to meet you live. You can come and ask questions. You can ask questions about the program as well if you're interested in that. And if you're not able to come live, you can still sign up and I'll send you the recording. So I'd love to see you there. I'll put the link in the comments, and I'll see you again tomorrow for some more sleep tips. Bye for now.